Thanks, Matt Dorian, a GP from Queen's Road Medical Practice. This is the first in a series of short video clips that we are putting out to discuss topics that might be of concern or interest to our patients during the COVID outbreak. And the first thing we're going to discuss is high blood pressure in COVID. The reason for choosing this topic is there is some reports in the media that people with high blood pressure are at risk of getting more severe infection with COVID, and also there's been some supports that some of the medications might not be safe to take, and this is blood pressure medications, might not be safe to take if you were to become infected with COVID. And we thought it important to address those things, but also to talk to people about how they can access medical care during the COVID outbreak should they be concerned about high blood pressure. So some of you watching this might be on blood pressure medication already. Others of you may think that you have high blood pressure and want to talk to someone about it. And it's important for you to know that our GP surgeries are open. We are happy to talk to people about things. We are dealing with problems over the phone in a significant number of cases. Occasionally, if we think we need to see somebody, we'll bring people in for face-to-face consultations. Just to reassure you that we're following all public health guidance on that. And so if you do get asked to come for a face-to-face consultation, you can do so in full knowledge that you will not be put at risk of catching COVID. So one of the questions I get asked as a GP a lot is what level constitutes high blood pressure. And generally speaking, as GPs, we like to see people's blood pressure 140 or below as the top reading, and the bottom reading 90 or below. When you do your blood pressure, you get a top and a bottom reading, and the normal perfect blood pressure would be a 120 over 80, but it's part of the natural aging process that our blood pressure goes up with age, and once it gets above the sort of levels of 140 and 90, then we would think about treatment. It's important to say that that's a sustained reading, so people who have one-off isolated readings where it's above 140 or 90 don't necessarily need treatment, and we would like to see what the trends are and whether this settles down. It's quite frequent that blood pressure will go up when it's being tested, and we like to make sure that we're getting a true representation. So some of you may be on medication and you might be concerned about how you get your blood pressure monitored during the outbreak. Others of you may have had high blood pressure previously and wanted it followed up, but a bit reluctant to come to the GP to get it done. And one option for everybody is to buy a blood pressure monitor. They are available at pharmacies, all pharmacies, and they are not overly expensive. You can get a good quality arm blood pressure monitor, one that goes above your elbow, for somewhere between £10 and £20. And we would recommend the ones that go on the arm rather than the ones that go on the wrist, as they give a better reading. People will often ask me, is my home blood pressure monitoring safe, and is it accurate? And the simple answer is yes, it is. The machines that they have now are very accurate and give you just as good a reading as they would if you were here in the surgery being seen by us. So monitoring your own blood pressure is certainly something you can do during this COVID outbreak. And if you have concerns that it's high, or if you're on tablets and you think that blood pressure isn't as well controlled as it was, then please do give us a call and we can discuss things. I wanted to address those two things I started talking about, which is that people with high blood pressure are at risk of getting more seriously ill if they get infected with COVID. The first thing to say is it's extremely common to have high blood pressure. A quarter of all UK adults will have high blood pressure. So if you've got high blood pressure, you're not alone. The vast majority of people who get COVID and have high blood pressure will have a mild or moderate illness. There is some evidence that, as with other conditions, having high blood pressure will put people at higher risk of becoming more severely ill. But what we do know from blood pressure treatment generally is that if we can control your blood pressure well, you're at less risk of those sort of complications from high blood pressure. So if you do have high blood pressure, it doesn't mean that you're automatically going to get severely ill if you get COVID. In fact, the statistics would say that you're much more likely not to get severely ill. However, if you've got it, it makes sense to control it. The other thing that's been in the media is that there are some medications that were reported initially, at least, to potentially make people more ill if they took them and then got infected. And these two medications, which are quite common medications, are called ACE inhibitors and angiotensin 2 inhibitors. Both of them are blood pressure medications. The ACE inhibitors are the group of drugs that end in pril, so ramipril, perindopril, lisinopril, and the angiotensin 2 inhibitors are the drugs that end in sartan, so losartan or eplosartan. And some of you may be on those drugs. They're fantastically good drugs at controlling blood pressure, and they're useful for people with a whole lot of other conditions as well, diabetes, heart disease. I'm glad to say that the evidence has been looked at, and the expert consensus is that there is no increased risk from taking these medications, and if you're on them for blood pressure or any other condition, then you should continue to take them. One thing I would say on that is that blood pressure medication generally is used to bring your blood pressure down. There's no great surprise there. If you become unwell, this isn't just for COVID, but if you to get an illness that makes you dehydrated, and that would often be a feverish illness, a flu-like illness, something that caused diarrhea and vomiting, that illness itself generally tends to bring your blood pressure down. And if in that circumstance you take your blood pressure medication whilst you're already quite unwell with a high fever or dehydrated, that can bring your blood pressure down even further and can be dangerous. So whilst taking your medication, your blood pressure medication, throughout this period is a sensible and the right thing to do, if you do become unwell with a high fever or you think that you're dehydrated, then it's reasonable to think about withholding your blood pressure medication, but I would urge you in that case to discuss it. If you're unwell enough to think about holding off your blood pressure medication, you should really be discussing how you feel with your doctor. So please give us a call if that's the case. One thing I wanted to talk about as well as medication was all the other things we know that can control blood pressure, and the fact that they're all still extremely relevant in the COVID outbreak, and actually it might be quite a good time to think about addressing them. So we know that weight and exercise has an effect on blood pressure. So if you're overweight, that can increase your blood pressure, and if you don't exercise regularly, that means that you're more likely to have high blood pressure. So by exercising regularly and by trying to control your weight, you can bring your blood pressure down. And although there's many restrictions on us at the moment in the lockdown, exercise is something that we're able to do. And if you're able to get out and do some exercise, it would be a good way of controlling your blood pressure. So 30 minutes of regular exercise on a daily basis would be our recommendation. And the sort of level that you're looking at is when you're slightly out of breath and might struggle to hold a bit of a conversation. Regarding weight loss, then that too, as I said, can help bring your blood pressure down, and sometimes exercise and weight loss can go hand in hand, so that would be a good thing to do. We also know that salt has a significant impact on blood pressure, and in some people really quite significant. So by limiting your salt intake in your diet, you will certainly decrease your blood pressure, and in some people quite significantly, so that's something else to do. Alcohol intake is an important thing to consider during the COVID outbreak. It's obviously a stressful time, and some people might find that they're reaching for a soothing glass of wine or a beer just to help them relax. Of course, sensible drinking can be very healthy and can help you relax, but regular alcohol will have a definite effect on increasing your blood pressure. And if you're drinking above the recommended intake of 14 units a week, and you're drinking on a regular basis without days without drink, then there's a significant chance that you could be increasing your blood pressure. So again, it's a good time to think about moderating alcohol intake, following those guidelines, having at least 2 days a week where you don't drink, but more likely 3 or 4, and then enjoying responsibly some alcohol on those other days would be beneficial for your blood pressure. Something else I wanted to talk to you about briefly is smoking and high blood pressure. If you've got high blood pressure and you're a smoker, we know that all of the risks from high blood pressure are increased. We also know that giving up smoking is a really quite difficult thing to do, particularly in a time like this when you may be feeling more anxious. However, possibly it presents an opportunity. You could talk to us and we could think if there are ways that we could help you stop smoking. And there are medications that we can prescribe as doctors that will help people stop smoking. And it's as good a time as any to consider doing that. And I'd really recommend it to anybody who, whether they have high blood pressure or not, to think about stopping smoking during this time. So I hope that's answered some of your questions on high blood pressure. I hope we've made it clear how we're here to help if you have got high blood pressure. If you've got any questions, please do put them to Queen's Road, and you can post them to us, email to us, and we'll be happy to get back in touch with you. Thank you very much.